My name is Raylena Tucker, and I've been a nurse for 18 years. I have worked in hospital settings in multiple areas. I've worked in labor and delivery, nursery, med-surg, same-day surgery, recovery, now public health. But I wanted to talk to you today as other nurses about political advocacy in nursing practice. Like many of you, I found myself put in some situations that were unsafe. Unsafe for my patients, therefore unsafe for my nursing license. Have you ever been given a report that you knew was impossible? Has a doctor ever tried to get you to do something that was outside of your scope of practice? Have you ever been floated to another floor that you didn't know how things worked on that floor? You had not been oriented, and therefore that was an unsafe practice. So to make sure our patients are protected, we must stand up for ourselves as nurses and get some set guidelines. So as a nurse, your expertise, empathy, and enthusiasm are needed not only in the healthcare setting, but also at our state and nation's capital. To ensure our healthcare policy gets passed that advances the nursing profession, protects our patients, and protects ourselves, we need to be involved in the political process. So I want to start by talking about what being a political advocate is. Know some of the issues that are currently in the nursing profession right now, and then how you can become a political advocate. So I want to start with this quote from Thomas Jefferson. We in government do not have government by the majority. We have government by the majority who participate. So we all need to be involved. So the importance of being a political advocate, as a nurse, you come face to face with issues associated with patient safety, access to services, clinical outcomes, and health care disparities. Nurses must move out of our comfort zone. We're not used to being in the political eye. We're not used to this process. But advocacy adds a dimension to the professional practice that offers the reward of having more control over patient care and outcomes. So we need to know what our issues are in nursing. There are several persistent issues, which are nursing education and research, scope of practice issues, not only for RNs, but nurse practitioners, the Interstate Nurse Licensure Compact, safety issues including staffing, care coordination, and nursing fatigue. I took this from the American Nurses Association, and this quote says, "Massive reduction in nursing budgets combined with the challenges presented by a growing nursing shortage have resulted in fewer nurses working longer hours and caring for sicker patients. This situation compromises care and contributes to the nursing shortage by creating an environment that drives nurses from the bedside." How many of you have been driven from the bedside? There are a few states that have already made legislation, and they're listed here. Oklahoma is not one of them, unfortunately. The Agency for Healthcare Research and Quality did a study, and it links hospital nurse staffing increases with fewer adverse events, therefore lower lengths of stay and decreased cost. So the right number of staff with the right skill level, in the right place at the right time with the right assignment. Kind of like the 5 hours of medication administration. We do have a Registered Nurse Safe Staffing Act that was introduced in April of 2015 by 3 representatives of different states. It calls for a bipartisan legislation, requires Medicaid participating hospitals to establish committees composed of at least 55% direct care nurses to create nurse staffing plans for each unit, because each unit is different. It protects nurses and patients, it cuts cost, by decreasing adverse events, falls, injuries, infections, decreases hospital stays, reduces readmission rates. It also mirrors other state models. It considers an RN's educational experience, professional certifications, level of clinical experience, the number of other healthcare professionals on the floor, the intensity and complexity of that patient. It also ensures that nurses are not forced to go to other units that they've not been oriented to. It establishes a procedure for receiving and investigating complaints. It also establishes a procedure where they can impose civil monetary penalties for each known violation, because we know unless hospitals are hit in the pocket, they're not going to change. And it requires them to publicly report their staffing information. We need to do a real quick review of the policy process. Laws originate as legislation or bills in either the U.S. Senate or the House of Representatives. They each have subcommittees. A bill must pass a committee by majority vote, and then it goes to the floor, and that's where it's, during markup, they may add some amendments to it. It has to be considered in both houses and passed in both houses, and then it goes to the president. Now, the president can sign the bill, and it's a law. The president can veto a bill. It goes back to Congress, and if it passes by a 2/3 majority vote, then it becomes a law. Or the president can pocket veto the bill. If he doesn't sign the bill and Congress is in session and it's been 10 days, then that bill automatically becomes a law. So how can you as nurses participate in this process? Number one, you just need to be involved. Know who your senators and your representatives are. If you go to capwiz.com, you can put in where you live, and it will tell you who your representatives are so that you can contact them. But one of the best ways to combine your voice with others is to consider an active membership in a national organization or a state organization. The American Nurses Association or the Oklahoma Nurses Association, they have a lot of information that you can find information about tons of topics that you might have an interest in. They also let you know when something is coming up and you need to be active. You need to be a voice in that. You can also go to the nursingcommunity.org, and it gives you more information about the nursing community and the members. So when you contact these representatives, you can call, email, fax, mail, but really the best way is to make a visit. I know not everybody can do that, but they do also read they have someone who reads all of their emails and takes all of their calls. You can be involved when you know what's going on. For example, in May of 2016, Nurses Take DC, they talked about the safe staffing issue. They had a bunch of nurses with signs getting their voices out there. If you're really interested, the American Nurses Association created the American Nurses Advocacy Institute, and it's a year-long mentoringship program, and they help to develop nurses into political leaders. So now that we know what the issues are, we know that we need to join an organization, and we know we need to get involved. So let's take control of our profession by knowing these issues, becoming political advocates, so we provide the best, safest care possible to our patients. Do you have any questions?
No.